my name is Nevashan Govender, so I don't have the title of doctor yet.
Oh, okay.
But yeah, so Nevashan Govender, um, and I'm a graduate of the South African Field Epidemiology Training Program. Um, I'm I'm old enough to have gone through the program when it was still SAFELTP, where they still had the laboratory component in it. Um, but that's not to say that the program hasn't evolved, and so yeah, I'm still employed at the National Institute for Communicable Diseases, currently within the Outbreak Response Unit as the operations manager of the Emergency Operations Center. I've been in the role since 2016 and worked previously as a provincial epidemiologist, as a research manager. I have a background, a laboratory background within masters in clinical microbiology and infectious diseases. Yeah, just loving the contributions I can make, the little contributions I can make to public health.
Talk about the role of field epidemiologists in responding to the COVID-19 epidemic and how that role continues to evolve.
Well, being a field epidemiologist at heart, I guess in South Africa, the role of the field epidemiologist was actually to raise the red flag. So within the Outbreak Response Unit, we conduct event-based surveillance, and we picked up on the alert December 2019. I remember the day really well. Obviously, it changed the course of history for all of us. And it was actually New Year's Eve when this request for further information came through ProMed, and we picked up some of the other news articles. And look, everybody was in a celebratory mood, to bring in the new year. But something deep down, with all the training, it just told me that this was extremely unusual, and that in the new year we were in for quite a new year. And we sent off an email saying that we need to do a risk assessment for this because it's an unusual event, and really that started the cascade of a new appreciation for field epidemiologists. In the South African response to COVID-19, field epidemiologists played a crucial role, from the epidemiology and surveillance perspective of the National Incident Management Team, which was a component that the National Institute for Communicable Diseases led from the very beginning to the end of our local response. We deployed field epidemiologists to subnational levels, to provinces and districts, to assist with any of their epi requirements. So around data management and the epi contact tracing, the daily reporting that was required at the national level, the establishment of new data systems that occurred here at the National Institute for Communicable Diseases. This was an online platform. And really the role of field epidemiologists really did come to the fore, to the extent that it actually facilitated non-governmental organizations that were assisting in the response, such as the World Health Organization and others, to employ field epidemiologists or epidemiologists to be able to further support our local response. And I think this is in keeping with the vision for field epidemiologists, particularly in South Africa. In the history of field epidemiology in South Africa is definitely not new. One of the former deputy ministers of health attended an EIS conference in the US and was introduced to these disease detectives, and he said that this is what he wants in South Africa. He wants his own career of disease detectives in South Africa, and this is how the program was born. And 17 years later, hundreds of graduates, and a lot of us, continue to work within the public health sphere on a day-to-day basis. I think the challenge in South Africa and many other parts of the globe is that field epidemiologists as a profession, we do not have our own national registration as a as a profession, and so often the skills are required by within the public health service, but you cannot be employed as a field epidemiologist specifically. The jobs are advertised as, for example, Deputy Director for Communicable Disease Control, or within certain health programs. And so, you get involved in programmatic management, but you utilize your skills, but you're not always involved in the technical aspects that where we love to get our hands dirty. I can say the same for myself. I'm now in a management role within the Emergency Operations Center, but that's not to say that the role of field epidemiologist is not appreciated. It definitely is.
Yes.
But as you said, that it's evolved. Yes, we are seeing more than just these field operatives. Our skills are vast and continuously evolving in terms of data management, disease detection, modeling, public health emergency management, and so it's a really great entry point into this ever evolving public health landscape. And it really does provide you with this foundation of skills, and then you can actually grow into your own niche, and find your own place within the public health system. Field epi, in South Africa has formed the basis for many great careers. I'm really proud of where I am and definitely my roots in field epi. We employ a number of graduates here at the National Institute for Communicable Diseases that continue to work in the different surveillance programs that support public health responses and technical advisories, as well as field epidemiologists being employed as provincial epidemiologists to continue to support at the subnational level. We have graduates that have moved on to other countries or to other institutions. We had graduates that have worked for the Africa Centers for Africa CDC. We have a graduate of our program that works at the WHO in Geneva. Was a really great friend and one who actually encouraged me to do apply to the program, and really changed the course of my career. So the evolution is ongoing, and I think that at the moment field epidemiologists are helping to support in South Africa the rollout of the integrated disease surveillance and response strategy. South Africa being one of the last few countries to adopt IDSR in Africa, but having this base of really knowledgeable, passionate field epidemiologists working in the sector for NGOs that are supporting this work within the National Department of Health, as well as here as the NICD. We have all positive vibe about making this a success.
Okay, thank you for that. The other question I wanted to ask you is, how has the field epidiscipline evolved through responding to the COVID-19 pandemic?
So, the COVID-19 pandemic brought with it a lot of challenges, an immense amount of challenges. And yes, we are trained and we get to do, for our competency, we need to do a certain number of outbreaks, within our 2-year period as a minimum of 3. But nothing could prepare any of us for a pandemic. I don't think any of us had predicted that we would see one in our lifetimes. But Be that as it may, it was actually a really great experience. The hindsight is 2020, isn't it? And I think all of us that have come out of it are stronger epidemiologists, stronger public health people as a result. And the reason for this is that it helped us to develop individual resilience. It really did test us, but it also highlighted the importance of us being leaders within where we work, where we operate, and the teams that we are drawn into support. Field epidemiologists, and especially in South Africa, always looked at to be able to lead outbreak response teams. They were always seen as a resource of knowledge. When there are issues with any data or analysis, it's the field epidemiologist that steps into that space to troubleshoot, to fix. And this has only been further highlighted through the COVID response. And that the role is broader than, like I said, just being these field operatives. The work that we're able to do from at the different levels, whether it be a national, provincial, or lower down, the networks from the day-to-day work that we do, the networks that we develop, were really critical in being able to identify the key stakeholders, like I said, to be able to troubleshoot and problem solve on our feet. And this, we definitely fell back on our training and our base thinking, but this showed that how adaptable and how flexible field epidemiologists can be. And so coming out of the COVID-19 response, we are trying, and I think it's universal, we're trying to build on these lessons. We are trying to be more resilient. We are trying to try and support people to actually become better leaders in their space, to be more analytical in their approaches, to continue to strengthen their knowledge around how public health is changing, around infectious diseases, and the broader spectrum of public health, to be able to work with different stakeholders that they may not have previously worked with, because it's absolutely critical. The COVID-19 response showed us that, really hammered home the fact that outbreak response is not a one-man show. Collaboration is absolutely key, and working with your stakeholders, between in the inter-outbreak periods, in terms of preparedness and continuous education, alertness, and sustaining those networks are real critical components to what it is that we need to have in place. And this is a key role of a field epidemiologist. When you're in the FETP programs, you are taught how important communication is, how important it is to be able to write good reports that people can learn from. What it is that you do, even if it is a simple evaluation. You may think that it's a simple evaluation as a competency, but all these findings are areas for improvement that will always keep us in a better position if they're acted on for the next outbreak, for the next pandemic. And this is it's a continuous learning environment that we're in. And I think that with this adaptability and this resilience that we have come out with, we can only just continue to evolve. And I think a lot of people did not appreciate how resilient epidemiologists are, and how they would just keep pushing day in, day out, often without much rest, without much break. It also highlighted from a management perspective how important it is to be able to understand burnout, to be able to identify when people need to rest. Mental health became such a big component. and to be able to address those type of things so that you're not over exerting your human resource. Collaboration is key so that you can have smaller teams, you can have surge capacity, and then you can call on your resources, rest those resources. And obviously, like I said, I mean, field epidemiologists for an outbreak are an absolute must. And so you do not want to exhaust those resources. And so we have learned some valuable lessons. We've learned how important it is to exercise, how important it is to plan, how important it is to, to have forums where you can learn from each other, where you can express yourself, and to create safe, conducive working environments are really, really key to being able to move forward.
Okay. Let's stick with that theme. Could you share some more lessons that you've taken from the COVID-19 response?
Yeah, so I mean, the COVID-19 response, definitely from a South African perspective, and because of the work that I do, I've traveled to other countries and have colleagues in many different countries that I've spoken to. I mean, one of the key lessons that we have come to appreciate is this early warning and being able to do these rapid risk assessments with the information that we have at hand. And as a field epidemiologist, we are involved in surveillance, and we learn how to interpret the surveillance data, whether it be indicator-based surveillance or event-based surveillance. And being able to merge the two types of surveillance to paint a broader context, as well as to utilize the different tools that are available, different data visualization tools, being able to map things, draw on different resources, whether it be climatic data, environmental health data, etc., to have a more holistic view of that situation, whether it be COVID-19 or cholera or mpox, etc., is extremely vital. So integrating not just the data, programs, people, bringing them all together so that we can have a broader view, especially in the initial stages of what we think may be an event that we need to respond to, is critical, because that informs your risk assessment, informs your early interventions. And we have definitely learned the importance of this. We have definitely learned the importance, like I said, of planning, and not just planning for the sake of having a plan, but then exercising and training and orientating on that plan and keeping it updated. And obviously, what keeps that updated and what allows you to do exercises and training is having good quality data that's able to inform the scenarios. And then you have this, the different cadres of individuals that you would need in your outbreak response teams and your rapid response teams. And epidemiologists are key components to that. I can't emphasize that enough. So we definitely learned those lessons. We learned lessons around having systems in place, data management systems, surveillance systems that are robust. And these are all critical components, not just for pandemic preparedness, but just for day-to-day operations, which are all supported by field epidemiologists and better informed by them. We know that we've definitely learned that, I will reiterate again, that we cannot do things alone. COVID-19 definitely taught us that, within a 24-hour period, a disease could be in one country and then, circumnavigate the rest of the world and become a problem. So developing networks with public health agencies, developing networks with other government departments internal to your country, having a multi-sectoral approach, not just to your response, but to your preparedness, to your normal sharing of reports, having this collaborative element to how you actually conduct your day-to-day business, so vital, absolutely vital. I think that it is human nature to want to protect your little piece of land, to protect, but no man is an island, no program is an island, no disease is an island. Diseases don't respect any borders or boundaries or anything like that. And so our thinking, we definitely learned that our thinking needs to be more integrated, our approaches have to be more integrated, and we have to be more collaborative. So whether that is public-private partnerships, whether it is with NGOs, whether it was with neighboring countries, like I said, with other public health agencies, we are working really hard to establish these networks with other public health agencies, whether it be formal or informal, with neighboring countries, with different programs. And if they're informal, then to try and move to formalize these. But it's so critical to have these relationships. Very often, the best interventions are made through, just working with other people by having these relationships, and then you sustain them. So, vital lessons learned.
Thank you for that. There are lessons from the COVID-19 response that are now informing future outbreak response.
Yeah, definitely. I mean, we're currently in the midst of mpox fake, and we've had many discussions with a number of public health agencies, and I think that a lot of what we have in place from 2022 was able to address our current 2024 outbreak, but a lot of what we had in place in 2022 was actually coming out of the COVID-19, the lessons that we learned from the COVID-19 outbreak, from having incident management teams, from working in a structured approach, from having plans in place, from having these guidance documents in advance or generating them really quickly, by doing just-in-time training, by having data systems, maintaining really good line lists, just doing the basics well. Because some of these mistakes were made in the initial stages of COVID-19. From a South African perspective, we could always say that maybe we should have been a lot better prepared for COVID-19, because we were coming out of almost a 2-year response to a large listeria outbreak, the largest documented listeria outbreak in the world. But if there isn't, this continuous effort, if there's no political will, if there's no continuous advocating, and if you are having the conversations but you're having them towards deaf ears, sometimes it actually does take a catastrophe or a large emergency like COVID-19 to get people's attention, and that's definitely what's happened. Have we come out of it having learnt every lesson? Have we come out of it with a true appreciation of improving and a true appreciation of all our gaps and having a comprehensive improvement plan? Yes, we do have improvement plans, but that needs investment, that needs a continuous engagement, and it's up to us as epidemiologists, as field epidemiologists, not to let that energy die. We need to continue to push the envelope, have the difficult discussions, use evidence that we have available to us to go, look, should we not be able to address these gaps come the next pandemic? We may find ourselves wanting. Obviously, with mpox at the moment, it's slightly different from what COVID-19 was. And so, all the gaps that may have existed coming out of it, or all the lessons that we have documented that we need to be able to address, are not necessarily 100% applicable. But I have really good faith that we will get there. I know I may look terribly old, but I still have a few more years to go. I do have a few more years to go, and I hope that by continuing to work in this space, by continuing to engage with other field epidemiologists, that we can continue to inspire, if not this generation, then the next generation to keep pushing, to keep trying to address these gaps, to keep trying to improve the system, so that come the next pandemic, we're not making the same mistakes that we made, and that it's not just lessons learned. Saying lessons learned is just saying it. Very often, in the African context, it's lessons documented, because we don't act on our improvement plans. We don't invest in that preparedness. We don't invest in the planning and the resourcing, the hiring of field epidemiologists at the rate that we need them, putting them in every district, at every level, having the analysis for the early warning, having the systems in place. So we need to be able to get there, and hopefully it happens before I retire. I mean, I have 25 more years to go, and I have a good faith that that we can be part of the solution. And it does take it's going to take all of us, across the continent, to keep having this conversation, to have the difficult conversations, ask the difficult questions, make people feel uncomfortable. We need to be agitators for this change, and we need to do it in choose your forum, choose when to fight, do it in a kind way. Field epidemiologist, one of the key principles or key aspects of being a field epidemiologist is to be humble. So put that message across and just keep pushing. The worst thing for me, from my perspective, is that we run out of energy, and that we lose the resilience that we've built up, and we stop this fight, because we can only do this together. That's true collaboration. We can only do this together. Whether if South Africa is stronger and we win some of these battles in South Africa, that's great, and maybe we can influence the neighboring countries, and then that means all of a sudden Africa is going to be stronger, and then maybe it'll move up the continent, and then with the initiatives in West Africa and East Africa and North Africa, and maybe we'll meet in the middle, and that will be a day to celebrate.
All right. Thank you for having this conversation with me. Those are all the questions I had for you, and thank you for taking the time to talk with me about the COVID-19 response in South Africa.